Hey, my name's Andrea Smith. I'm the pastor of West Church. We worship traditionally at Lake Norman High School at 10 a.m. And this morning I am joined by Dr. LuAnne Gatlin and Dr. John Gatlin. I've known the Gatlins for 18 years actually. When I moved here, they were recommended to me by someone else who they were their doctor, and so they became my doctors, and now they are a part of the West community. We are very blessed by them, and we've talked about some of the things that they are going to be discussing with us today about COVID-19 or coronavirus, and I really think you're going to learn a lot, and you're going to get a lot out of our time together this morning, and we're all hoping that it's not going to turn into a really bad episode of the Jerry Springer Show. We've had some uncut conversations as well, so we are hoping this is going to go really well. They both graduated from the Medical University of South Carolina. They did their internships and residency in the Greenville Hospital System in South Carolina. And John graduated 1 year before LuAnne did in medical school. And in their both final years of residency, they were the chief resident, which if you watch Grey's Anatomy, that's really, and they hate it when I tie their profession to a TV show. But anyway, it's relevant. So anyway, they truly are brilliant doctors, and we are really lucky that they've chosen to give their Sunday morning and their wisdom and intelligence to us. We also are letting you or asking if you have any questions that you would like for the Gatlins to answer. You may text the number that you'll see periodically on the screen. We will try to get to your questions. If it looks like time is not going to allow that, I will address your questions with the Gatlins after our live filming is finished, and I will put the answers on the West website, headingwest.org, and my Facebook post and the West UMC Facebook page. So let's get started. How did the virus start, and when was the first case in North Carolina?
Well, it first emerged in the Wuhan province in China in December of last year, and it has quickly spread. It is believed it started in their market and possibly from animal to human transmission. And the first reported case in the United States was January 20th in Washington State. And the first reported case in North Carolina was March the 3rd.
Oh, okay. So just a month, well, not even a month ago in North Carolina, right?
Yes.
Okay.
And that was actually someone who had traveled from that nursing home in Washington State.
Oh, really?
And came back to North Carolina.
Oh, wow. What are the symptoms of COVID-19?
The main symptoms are respiratory. So a dry cough, fever, and we look for temperatures like 100.4 or higher. And also shortness of breath. Some people get gastrointestinal symptoms. There are receptors in your pulmonary system, your lung system, that are similar to the receptors in your gastrointestinal system. This is easier when I sit out there and watch you do this.
I know. It's a little intimidating
Just
to
a tad.
just be on TV. I get it.
So some people also get nausea, vomiting, diarrhea.
Really?
Mm-hmm.
All right. How is COVID-19 transmitted?
It is mainly transmitted through respiratory droplets, so if you cough or sneeze. And generally it's thought to only go about 3 to 6 feet, so that's why we talk about social distancing. It also may be transferred by those droplets getting on the surfaces, though that is not thought to be a main concern of the transmission.
Oh, really?
Well, it's not as virulent on the forms, but we still need to be cautious and clean the surfaces and avoid touching common touched areas.
And so let's talk about going to the grocery store, because clearly, since we have bought every piece of meat that exists in the Mooresville, Lake Norman area, and you cannot find anything in the grocery stores except for turkey necks, which I was able to find this week, but that's about it. So let's say that somebody's going to the grocery store and they have this, they don't know that they have this, which is part of the danger of this, right? Like it takes a while for it to show up. Right. In symptoms?
Yeah, the incubation period's actually up to 2 weeks. So you can be sick with the virus but not have symptoms for up to 2 weeks.
And that's one of the things that makes it so dangerous, right?
Yes.
Okay.
Though it is felt the most contagious time is when people are showing symptoms of the fever.
Oh, that's good to know. Say that one more time.
Well, there is a chance that you can spread it when you're asymptomatic, though they feel is the highest rate of spreading it is if someone is symptomatic with the fever and the cough or sneezing.
Okay. So, well, what I hear you saying is that, I think we've all been panicked. I mean, there is such a high level of panic and anxiety around this right now. And I think people are afraid, like, if they go to the grocery store, that somebody that has it, and didn't know that they had it. Because I think we're all owning that if we have it, we're not going to go out, but because they don't know that they have it. They go to the grocery store, they sneeze or whatever, or just get their germs on the buggy. And then, like, I go in, I touch the buggy, and then I get the disease. Is that likely?
I wouldn't say that it's super likely, but it's possible.
Okay.
So that's why it's important to wipe down surfaces. Don't touch your face. Don't touch something and then touch your face. And then wash your hands.
Okay.
And we do know that the virus is easily inactivated in less than a minute after wiping it down with approved solutions, the alcohol or the Clorox cleaning wipes.
Say that again. It's what?
It can be inactivated within 1 minute of cleaning the surfaces with the approved cleaning substances.
Why do we need to wash our hands for, 20 seconds?
2 happy birthdays.
2 happy birthdays?
It's important because if you touch something, and then we all touch our face all the time. So if you touch something and then touch your face, then you could spread it to yourself. So it's just important after you've touched items or somebody else to keep your hands clean.
Does it take 20 seconds to get, I'll confess, like when I wash my hands, I throw some soap on, I do this, and I'm all finished. Why is that not good enough?
It just doesn't clean your hands well enough. That's not
really?
long enough to get rid of germs that are on your hands.
So I've been doing it wrong all this time.
So we'll stay away from you.
Oh, good. And most of the church will too. All right. And how long can it live on surfaces? Like, let's pretend that they don't get a surface cleaned. Like, let's go back to the grocery store scenario. They don't get it cleaned, but somebody that was contaminated, got germs, or is it okay to say germs? Is that the right term?
Sure.
How long can it live on a surface?
Well, the current research suggests it can last from 2 hours to 2 days. However, some of the fear and panic is taking that research out of context, because the amount that is still on the surface at 2 days is less than 0.1%. So it's very unlikely that amount would cause someone to catch an infection.
Okay. All right. Good. So what is the difference between the flu, between allergies, and the coronavirus?
That's a great question, because people are freaked out anytime somebody sneezes or coughs. Allergies are easy. First of all, you don't get a fever with allergies. So there's no temperature. Ever. It's not caused by a virus or a bacteria, so you just don't get a fever with allergies. And that's mainly watery eyes, sneezing. Sometimes you have cough just because you have drainage down your throat and that makes you cough. And the flu is a lot of myalgias, which are like body aches, fatigue, still cough. But the thing about the flu is it's easy to test for. That's an in-office 10-minute test. And then coronavirus, like we talked about, is temperature up to 100.4 or higher, the dry cough, and shortness of breath.
Okay. All right. Why is there a shortage of test kits in the U.S.? Well, and the question before that, why are we seeing more cases of coronavirus?
Well, it has this type of coronavirus has several mutations that make it different than previous, and unfortunately, those mutations make it more contagious and people more susceptible. But again, we need to remember both the SARS pandemic in 2003 was a coronavirus, and since 2004, there's hardly been any reported cases of SARS. And then the MERS also was a coronavirus, and that was in 2012-13. And since that time, there's been few reported cases of MERS.
So that's an interesting point that I don't think just the average person knows, is that coronavirus is not just that's not one thing. Like, there are lots of coronaviruses and they have different names. Mm-hmm. Can you speak to that a little?
Well, the coronavirus actually got its name because under the microscopes, the electronic microscope, it actually
looks like a Corona beer?
It looks like it looks like a crown.
A crown,
yeah.
Okay.
Way to go there, though.
All right, sorry.
Yeah. Like any virus, though, it changes and adapts through the years, and that's why there are multiple different types.
Okay, so the two that you just mentioned, what were they?
SARS, the South Asia respiratory syndrome.
So that was a coronavirus?
Yes.
And then?
And MERS, the Middle East respiratory syndrome.
So that was a coronavirus?
Yes.
And so now this one is COVID-19?
Right.
Okay.
And it's actually more closely related to the SARS, but it is changed, and that's why it's more contagious. But so far, the mortality rates have been less than was reported with the SARS strain.
And I think that's really important for folks to hear, that the mortality rate right now with COVID-19 is actually less than the others in years past, right? Is that what you're saying?
So far.
So
yes,
far, right.
It has been.
Okay. All right. Why is there a shortage of test kits in the United States?
Well, we sort of got started late. The FDA and the CDC could have asked American companies to start making the testing kits sooner than they did. But one good news that just came out today is that they've developed a brand new test kit that is immediately available, and we get the results within a couple of hours.
Oh, wow.
Instead of 2 days, which is the way the prior testing has been.
Do y'all have kits?
No, we don't have kits.
So what happens if I wake up and I have the symptoms of COVID-19 or the flu? I don't know what's wrong with me, but I just know I really don't feel well. What do I do?
What we don't want you to do is go to the hospital, because if you have it, you can infect the people who are really, really sick. And there are testing centers around that's where you go and would be tested.
Yeah, call your medical provider and find out where the sites are for the testing. So they're centralizing the tests for coronavirus to keep people away from unaffected people.
Okay, all right, that's really good to know. Also, Dr. John Packman is a dentist with the West community, and he and I were speaking with one another yesterday, and he shared that, you know, most dentist offices are still seeing cases of emergencies. And if you just need a routine cleaning, that, you know, the offices are closed for that. But if there is a dental emergency, they are saying to call your local dental healthcare provider, not to go to the emergency room with that either. Because, I mean, we really want to keep our emergency rooms and our hospitals as places to care for those who are in dire need. Well, I just asked you this. What do you do if you have symptoms? And you said call your doctors.
Correct, and most important, stay home. And because we have to remember, over 80% of people so far who've had the coronavirus have only mild symptoms. But if you do, begin having more symptoms, call your provider, find out where's the best place to be tested, and then depending on your illness or severity, you'll be instructed if you need to go to the hospital or have more care.
Okay. You both know my medical knowledge is very limited, so I'm going to ask a question. Tell me the difference between mild symptoms. Like, what would a mild, I don't understand the difference between symptoms and mild symptoms. And I think it's important to hear, too, that 80% of the people thus far only experience mild symptoms. So just because we get the COVID-19 does not mean we're going to be in the ICU on a ventilator, right? I think a lot of people are afraid that if they get it, it means they're automatically going to need just extreme measures of health care.
Right, and like John said, the majority don't get that sick. So mild symptoms still are, the fever and the cough, but it doesn't progress to a severe respiratory situation where you require hospitalization.
All right. Can you have COVID-19 and be completely asymptomatic? That was a question sent in.
Yes, you can.
You really can. You just never will know you had it?
And that's really a big thing in people 20 and under.
Okay.
That's one of the reasons, it was important, if we're going to try to contain this and do our best, is when they stop school. Because kids don't get typically as many symptoms as adults do, so it would be so easy for them to spread it to people and not ever know that they had it.
Oh, wow. Okay. I think that helps us understand why schools and universities have, stopped the in-person gatherings. What should we be doing for prevention?
Well, currently the recommendations are the social distancing, so don't be around people unless you need to be. Definitely, if you're ill, stay home or avoid being around ill people, and try to take more personal hygiene. Try not to cough or sneeze in public. If you use a tissue, immediately throw that away. We need to wash our hands more thoroughly and more frequently, and again, clean surfaces that are commonly touched.
Are these like disinfectant wipes? I'm not promoting Clorox, but whatever. Are those effective at cleaning surfaces? What
Yes.
should we clean surfaces with?
Well, the Clorox type wipes, rubbing alcohol, and just general soap and water. Again, all those have been shown to decrease the virus within 1 minute of wiping down.
I do want to give a shout out to the people that are working to keep stores open for us that are necessary, like grocery stores and CVS, Walgreens, those type places, drugstores. I noticed last Monday in my quest for protein, I went to Costco and they really had it down to a system. I mean, they were wiping down every cart, and you had to wait in line and get a cart. And it was a little scary, actually, because it made this situation very real. But folks really were working really hard to try to prevent it and to keep it from spreading. Who are the most vulnerable? You mentioned that young children and 20 years old and younger could potentially get it and be asymptomatic. Who are our most vulnerable?
The CDC has identified the elderly as well as people with certain diseases like diabetes, any kind of cancer, heart disease, lung disease. Those are the people who could get sick and not do as well.
Okay. Immunocompromised, I've heard about that. What is that? What would that be?
Well, anybody with a less than normal immune system could get sick, but that's just across the board. They are more susceptible to illness, period.
Okay. Why is social distancing, we've sort of touched on this, but I want to ask it again. Why is social distancing, hand washing, and limiting of large gatherings so important? So I moved homes this past weekend, and yesterday a representative from the moving company came to my home. She came in. She was a little bit older than I am. I would say probably mid-60s. And so as she came in to I'm not quite 60 yet. She came in.
Yeah, but we are.
Oh, no, you're not. As she came into my kitchen, I kept backing up because she kept coming closer to me. And I hurt her feelings. I offended her. And she said to me, do you think I'm dirty? And I'm like, no, not at all. And she said, well, then why do you keep backing up from me? And I said, well, ma'am, because I'm trying to keep, 6 feet between us. And she just rolled her eyes and said, oh, that's so stupid. And I said, well, ma'am, COVID-19 is real, and I'm trying to respect a healthy distance. And she really did just blow it off. And I thought, this is part of our problem. It isn't stupid and it isn't silly. So speak to that, social distancing, limiting of large gatherings. Why is that so important?
Well, again, it goes back to the fact we know that it's transmitted through the respiratory droplets. So if you're not sneezing or coughing, though, it's less likely. But again, if you do cough, we know those droplets can go up to 6 feet, and then if you inhale them or they get onto your hands, then you're likely to get it. And again, the surfaces that you may cough on or sneeze on, that's why you don't want to touch those or immediately wash them down, and continue to wash your hands, because we all are creatures of habit, and we touch our nose or touch our eyes or touch our mouth. It kind of little sidebars, when one of the leading health professionals in the country were given one of the speeches early in this, they noted that she touched her mouth and nose multiple times during her speech. So,
oh, wow.
So
we just do it by habit.
Correct.
And it's a really contagious virus too. That's the other thing, that why social distancing and all those steps are so important.
All right. What are some of the biggest misconceptions about COVID-19?
So I have to read some of those to you.
That's fine.
One is, and some of these, I just pick my favorites. One is that if you gargle with bleach, that you can, I know.
Oh, my.
Yeah. If you gargle with bleach, then you cannot get it, and that's not true. Besides, that'll probably give you something worse than COVID-19.
Okay, I just want to stop for just saying, gargling with bleach is never a good idea.
It is
right?
not, no.
Okay, because
We don't recommend that.
I missed that. If that was a possible cure for anything ever, like ingestion of bleach is just probably not good.
And also that essential oils can keep you from getting it, and that's not true either.
Okay.
One of the other things was that someone has worried that the coronavirus was deliberately started, and that is not true.
Okay.
How it started,
I have heard that as a conspiracy theory.
Yes. These viruses can live in birds, bats, pigs, different animals, and then they undergo some kind of mutation that makes humans susceptible to them. So there is not any conspiracy theories or, anybody caused this virus to happen. If you order anything from China, you can get sick. That is not true. The other thing is, I know, wait, this one's good too. If you eat Chinese food, no, you're good to go ahead and have your,
Or drink Corona beer.
Yeah, you can have your sesame chicken and be fine. And the other thing is, one of the biggest ones I think is that face masks can protect you. And that's totally untrue. As a matter of fact, they may make it worse. They may make you more susceptible to the virus, because the people who buy those, medical professionals have fitted special masks, not just masks that you buy from the store. And so if you just get a regular mask, you're touching your face all the time because it doesn't fit right, and you're trying to adjust it. The other thing is that because it doesn't fit snugly, the respiratory droplets can get stuck inside the mask and make you even more susceptible to the virus.
Wow.
So if you're sick and coughing, then that's the person who should wear a mask, because what we want to do is not get those droplets out, and that's what the masks can help. But they do not help someone who does not have the disease keep from getting it.
So the people that should be wearing the mask are the people with COVID-19, right?
Or symptoms, yes,
Okay.
if they hadn't
Not
been
just,
tested.
I'm going to go to the airport because I have to do travel and I don't want COVID-19, so I'm going to wear a mask to protect myself.
And you're probably putting yourself more at risk.
Even if I'm immunocompromised? Is that the right way of saying that?
It is.
Okay.
Then you shouldn't be traveling right now.
Okay. That's a good point to note then. So if we are at risk, at higher risk, don't travel.
Right.
Okay.
The hand dryers cannot make the virus go away. And some people have said because of prior viruses that got better when, like the flu, that gets better when the warmer temperatures and the humidity gets higher, that this virus is going to go away. We hope so, but we don't know that for sure.
Okay.
Also, the situation with animals. There were 2 maybe cases in dogs in Hong Kong, but all the American Veterinary Association say they have not seen that in animals here, so we don't need to be concerned about that at this time.
Okay. All right.
And positive thinking won't keep you from contracting it.
Yeah. Yeah. Nor is it, this is some kind of God's punishment for humanity. That's just not really what we as United Methodists believe about God and theology. That's a different topic for another day, but yeah, positive thinking is probably not going to keep it from spreading. Do you have more misconceptions you want to share?
Those are the big ones.
Okay, so I'm just a little confused because there have been other diseases or viruses or whatever you want to call it in previous years, the flu, you know, that kind of stuff, but that has impacted people more severely and that kind of stuff. Why, if that's true, are we under all this quarantine and we don't know when that's going to end and all that kind of stuff? Why does there seem to be more panic and anxiety from a governmental area and, you know, more broadly than the other diseases in times past?
I think a lot of that is that this is the fear of the unknown. We don't know about this virus because it's brand new.
Okay.
The flu has been studied for years and years, and we sort of typically know what the patterns are. But this is brand new, so I think being extra cautious, but not panic.
Right.
But extra cautious.
So we don't need to go hoard toilet paper, paper towels, meat.
No, or soap. Because if you buy all the soap when you go home today, I can't wash my hands.
Right.
And so I'm putting more people at risk.
Right.
Well,
Moderation is key.
Yes.
Here.
and it is important to note that China, where it originated and still has the most number of cases, the previous 3 days they had no new cases. This morning they had one reported case. In South Korea, which in the beginning had the second most reported, that's not true any longer, but they are having not many new reported cases every day now too. So
Okay. What do you think has made it be less new cases in those regions?
that they did follow the strict, social distancing and staying inside if you're ill and taking the sanitary precautions more.
Do you know by chance how long they did the quarantine in those countries?
Not exactly.
Okay.
And I don't know, and I honestly don't know how extensive their quarantines were.
Okay. All right. What measures are being taken to develop a cure or a treatment?
Well, currently the FDA is working with both public and private companies and corporations under the Emergency Authorization Act to obtain medications for any people that need them. There are companies already working on potential vaccines, and actually a phase 1 vaccine has started in Seattle this week. There are studies with certain antiviral medications that we already have to see if they help, but those haven't been too promising. There have been an anti-malarial drug that has shown some promise in some studies. So it is a broad, concerted effort, and the CDC and FDA are also working with the countries of China, Japan, South Korea, and Italy, researching and their data with our data to try to find cures or prevention.
So I've read some things about vaccines, and if a vaccine were to be produced, it's still a year and a half before we can use it, right?
Well, under normal circumstances that would be true, but with the government using the Emergency Authorization Act, the treatments, the research and protocols and testing will definitely be sped up, but it still may be up to a year, but it will be quicker than normal.
Okay, all right. But that's different than their discernment of there are drugs that can be used to treat it and stuff, right? Vaccines that's different than, like, they can find something to give to people that have it.
Right. Vaccines are to prevent, so that you won't get it.
Oh, I see. Okay, all right. Showing my medical knowledge. You're impressed.
And then also John Hopkins is working on with some of the patients who've already recovered, they're taking their antibodies and trying to develop some type of treatment or cure from the recovered patients' antibodies.
Oh, wow. That's awesome. Okay. We have a couple of questions from our chat. So if you are joining us or worshiping with us, we invite you to text your questions in the chat box, and they're sending them to me. Is it true that different ethnicity groups, or like African Americans, are immune to COVID-19?
I don't know that anybody's immune to it.
Okay.
And I don't know if there are different ethnicities that are less likely to get it, but nobody is immune.
Okay. Another question is, can COVID-19 live on packages that are being delivered? Like if somebody is a delivery person and they by chance were to have it and sneeze or cough on the package and it's on our doorstep, can the virus live on that package?
I think it's like we talked about, it can live from 2 hours up to 2 days, but it is not nearly as likely that you would catch it that way. But still, there is absolutely no reason not to take a wipe outside with you and wipe that package down before you pick it up.
And after you open it,
Yes.
immediately go and wash your hands for
Right.
20 seconds and don't touch your face before
Right.
that.
Exactly.
One of the things that Dr. Packman shared with me yesterday when we spoke was that right now in this time, we need to assume that perhaps the people that we are interacting with could potentially be a carrier or be infected. That would make us be more intentional about things like social distancing and that kind of stuff. That was just a point he shared yesterday. We have just a few more minutes, so if you have any other questions, I invite you to share them with us now. The last question that I have for you guys, what are some of the most important take-home points about COVID-19?
One is don't panic. Like we said, don't go buy everything in the stores so that other people have to do without. But on the flip side of that is also don't be so cavalier.
Mm-hmm.
Don't think you can't get it, or don't think if you've traveled out of the country or have just gotten back from a cruise that you should not self-quarantine for 2 weeks.
Mm-hmm.
I mean, that's just what we need to do to help try to prevent it.
So you recommend a self-quarantine versus like you just get back from another country. You don't need to go be tested just
No.
because you got back from another country.
As a matter of fact, they probably would not test you
Okay.
because if you're asymptomatic, then you're not going to be tested. But it's important that if you've traveled, that you stay inside for 2 weeks. Also, avoid crowds, wash your hands, the same things that we've talked about.
Okay. Do you want to say something, Sean?
I'm good.
Okay. All right, another question. How safe is food delivery from restaurants right now?
I think that it's safe. Again, you would just do your normal, either reheat and wash your hands beforehand. I mean, that's one thing I do think it is important. I think we should support our restaurants with takeout or food delivery because of the severe economic stress, because the economic stresses that this is causing may end up outweighing the medical stresses.
Yeah. West is a part of a food truck mission with 2 other churches in our local area, and then we have volunteers from lots of area local organizations and other churches as well. Last Sunday we serve every Sunday at Parkview Elementary, and last Sunday we served, and then the remaining food we took to one of our apartment complexes that had some folks that had a higher level of need. And the manager of that apartment complex was sharing with me that several of the residents that live there had already contacted her and shared that because they were wait staff for local restaurants, that they were now unemployed and not sure how they were going to pay their rent. So I do want to second what John said. If you have the means and the opportunity to go visit some restaurants and get takeout, it is safe. It's just as safe and you may be thinking, oh, well, they could sneeze or, something like that. Well, that can happen anytime. I mean, again, I think we need to remember that flu and things exist just in general. So we always need to practice sanitary practices. So that's all the questions that I have. Do either of you have anything else that you want to share?
No, thanks for asking us.
Yes,
though.
thanks.
Well, I really appreciate it.
Just be cautious, but don't panic.
Okay, don't panic. I think that is an important thing. And one of the things that I just think is, again, so impressive is that right now there is a collective unity in our community, in our state, in our nation, and in our world. I think now it's been powerful to watch people that could be compromised and be carriers quarantine themselves because they're looking out for other people, and to bring a faith component into it, whether you're a Christian or not. I mean, Jesus taught about love and kindness. And I think now more than ever, in all ways, we need to be kind and to show great love to one another. So I'm going to invite you to join with me in a time of prayer right now, and then we'll bid you farewell. Let us pray. Gracious God, we just give you thanks for people that are so gifted in their field, like Dr. Gatlin's, and we are so grateful that they chose to use their time and their energy and their talents with us this morning. Thank you for all the people that have joined in or will join in later this week to try to learn how we can better take care of ourselves so that we can take care of one another, and this virus will quickly be not so anxiety-ridden and fearful for us. Thank you for all the people in our community and in our world that are working hard across the board to try to come up with solutions and ways that this can be handled. I ask that you surround them all with your protection, your strength, and your peace in the days ahead. Thank you for being a God of grace and a God of comfort. In times of uncertainty and fear, may we remember that if we go within, the power of the Spirit resides in each of us, and all we have to do is settle ourselves, and we can claim a peace even in uncertain times. Thank you for being that kind of God. In Christ's name we pray. Amen. A huge shout out of thanks to Dr. LuAnne and Dr. John Gatlin, and thank you for joining with us online this morning. I hope you have a great week.